So once we log in, we're presented with our scenario library. As you can see, I have access to any and every scenario here as I'm logged in as an admin. If I logged in under a student account, maybe I just see our adult suicide screening scenario, when I have to do it by how many attempts I have at it, because you can set these up as assignments. A couple things to note in the settings: we do have some different language options. You can also go from virtual reality to mixed reality, and then some accessibility settings below that. So once we're ready, we'll go ahead and pull up our scenario. And here we're presented with the pre-briefing screen. So Tyler's going to cover this with you guys, but we can change the avatar, we can change the environment, any of this information you're seeing. And then for the international folks, you can change the language of the virtual patient through the authoring tool. So we'll cover that here in just a bit. But for this scenario here, we have Ben Green. He was brought in by a concerned friend. He's recently been diagnosed with depression and has also just recently started Prozac. The learning objectives of our scenario is to initiate and maintain rapport, administer all 9 items of the PHQ-9, identify signs of moderate to severe depression, and then also to respond non-judgmentally to emotional distress or disclosure of suicidal thoughts. So once we're ready for that, we can go ahead and hit start.
Ben Green, a 23-year-old male, was brought to the ED by a friend after missing classes and not responding to messages. He is withdrawn, flat, and avoids eye contact. He recently started Prozac for depression, otherwise has no prior mental health history, reports feeling tired and unmotivated. You have been asked to complete a focused mental health assessment during triage. For this scenario, we will assume that appropriate hand hygiene has been completed and he has been appropriately identified. After the initial interview and assessment, proceed to the screening menu at the bottom of the Assess tab.
So a couple things to note here before we get started. Not relevant to our scenario, but you can see we can pull out diagnostic tools such as a stethoscope. There was also a pen light in there. If we wanted to check pulses, we can do that through assessments. We can put them on a patient monitor, and then within the treat tab, that's where you can give oxygen, medication, start an IV. It's grayed out as it's not relevant to our learning objectives, but those can be turned on in the authoring tool. So to speak to our patient, all I have to do is press and hold A on my controller, it processes, and then the patient responds. So we'll go ahead and start that. Hi Ben, I'm your nurse. Can you tell me what's going on?
I don't know. It's been rough lately.
I understand your friend brought you in. He said you're not feeling too well.
Yeah, I didn't really want to come. My friend made me.
Are you having any physical symptoms?
I'm just tired, I guess.
Are you feeling depressed at all?
I just feel tired all the time and I don't care anymore.
Okay, Ben. Well, if it's all right with you, I'm going to sit down. We're going to ask you some additional questions. Is that all right?
I guess that's okay.
Okay, so now that we know, we're going to go ahead and do a screening here. We'll go ahead and pull out our tool options.
What is the most appropriate screening tool to use during this encounter?
And you can see a couple different options here. These can be changed as needed. We're going to go with the PHQ-9.
Correct. The PHQ-9 is appropriate here as it is a validated depression screening tool that includes suicidal ideation and is commonly used in emergency settings to assess severity and risk. Although Ben is within the ASQ age range, the ASQ targets pediatric populations and the GAD-7 measures anxiety, which is not his primary issue. The CSSRS is a comprehensive tool usually administered by behavioral health specialists after a positive screen. Go to the chart to view the screening tool. When you are done with your assessment, come back to this menu to continue.
So you can see I already pulled out the PHQ-9. As we got to add up our score here, I can pull out a calculator over in the treat tab. And we'll go ahead and run through, for demo purposes, just a couple questions here for you guys to get the idea. and see what his responses are. So Ben, I'm going to ask you a series of 9 questions here, and I want you to answer if these have been bothering you over the last 2 weeks, and if they've been bothering you not at all, several days, more than half the days, or nearly every day. Can you do that for me?
Yes, I can do that.
Okay, Ben, have you been feeling tired or having little energy?
Nearly every day.
So we'll go ahead and give him a 3 there. What about trouble falling asleep or sleeping too much?
Yeah, I've been sleeping a lot more than usual nearly every day.
Okay. Are you having trouble concentrating on things such as reading the newspaper or watching television?
Yeah, several days. It's hard to focus sometimes.
So we'll give him a 2 on that. Actually, it should have been a 1. It's alright. Ben, thoughts that you'd be better off dead or hurting yourself in some way?
I guess I think about dying sometimes, but it's not like I have a plan or anything.
Have you ever tried to hurt yourself in the past?
Yeah, once.
Did you try to kill yourself?
Yeah, once.
Okay, well Ben, based off your answers to those questions, I'm going to go ahead. I think we'll probably get another clinician in here to have a little bit more of a further conversation with you, okay?
Okay.
Alright, so now that we kind of completed our PHQ-9, we're going to answer a couple questions related to that.
After completing the PHQ-9 with Ben, how should you classify his results?
And you can see here we can classify him as minimal to mild depression, moderate to severe, or is this just some severe anxiety? So we'll go moderate to severe depression.
Correct. Ben's PHQ-9 responses suggest moderate to severe depression requiring a mental health evaluation. Minimizing his symptoms overlooks red flags like isolation and suicidal thoughts. Based on Ben's PHQ-9 screening results, what is your most appropriate immediate next step?
So next steps for Ben, we could provide outpatient counseling resources. We could notify the attending provider and get a immediate mental health evaluation, schedule a follow-up for him in 1 week, or educate Ben on coping skills. So we're going to go ahead with the immediate mental health evaluation.
Correct. Ben's PHQ-9 shows moderate severe depression with possible suicidal ideation, requiring immediate escalation for psychiatric evaluation. Discharge without evaluation is unsafe. Delaying action increases risk. This is not a follow-up case. Supportive care alone is insufficient without addressing immediate suicide risk. It's time to provide your report to Dr. Jones in the form of an SBAR report.
Hi. What did you learn during your interaction with Ben?
So any conversation outside of the patient would belong inside of our dialogue tab here. So we got Dr. Jones, and we're going to work through this SBAR.
Which of the following best describes the current situation?
So Ben's a 23-year-old complaining of insomnia. He was brought in by a friend due to social withdrawal, concern for possible depression. Ben's seeking a medication refill. Or Ben called, he's experiencing a panic attack. So we'll go with his friend brought him in for possible depression.
Withdrawal and behavior changes are definitely concerning, especially with a friend initiating the visit. What background information is most important to include?
Background info on Ben. He recently started Prozac after being diagnosed with depression. He has a long history of anxiety and depression. He was brought in by his mother due to a recent breakup. Or Ben has diabetes, high blood pressure, came in with chest pain. So we'll go with he recently started Prozac.
New diagnosis and recent medication start. We should consider both therapeutic lag and potential side effects. What is your current assessment of Ben's condition?
So current assessment is he is showing appropriate mood and affect. He shows signs of moderate to severe depression. He's mildly anxious, or he appears physically healthy and we should discharge. So we'll go with he's showing signs of depression.
Agreed. The flat affect and withdrawal are red flags, and if he's expressing thoughts of dying, we need to act. What is your most appropriate recommendation?
So recommendations for Ben, we could discharge, follow up in 1 to 2 weeks. We could recommend an immediate medical clearance and a psychiatric evaluation. We could observe him overnight without psychiatric involvement, or recommend an additional dose of Prozac. So we're going to go ahead and get a immediate evaluation on him.
Good call. I'll order a behavioral health consult. Thanks for acting on this. Early intervention can make a big difference.
Dr. Jones states a suicide safety assessment will be completed. While not part of your RN role, understanding the process helps you support the patient and collaborate with the team. In the chart's documentation record, you'll find a flowchart of the typical steps following the PHQ and a sample safety assessment completed by the provider. When you have reviewed these documents and have explained to Ben what is next, feel free to end scenario by going to that button at the bottom of the Treat tab.
So you can see I just popped out a couple additional images. These can be changed to represent a local protocol, something relevant within your country, but just a couple different documents to reference. So here's a RN decision tree, a suicide safety assessment based off our conversation, and then next steps here we got to explain to Ben, and then that completes our scenario. Okay, Ben, I'm going to go ahead and we're going to get the clinician in here to evaluate you a little bit farther and see if we can get you some help, okay?
All right.
Do you have any last-minute questions for me?
No, I don't think so.
Okay, Ben, well, it's nice meeting you. I hope you feel better soon, okay?
Thanks.
So from here, we'll go ahead and end our scenario. We're going to be presented with a AI evaluation. This is just focused around my soft skills. And then I can review this here, how I did related to empathetic engagement, my PHQ-9 completion accuracy, overall professionalism, things I did well, suggested improvement. Tyler will show you guys how all of this can be changed. You can modify how the AI is evaluating the conversation. And then once I'm content with that, I'll come back. The real value of virtual simulation, I hit replay. I can engage with this patient time and time again until I really feel comfortable with this type of setting and this type of conversation. So that concludes the virtual reality demo. Now we're going to hop over to Tyler. He's going to show you in the authoring tool how we can modify this and also what this looks like on the web.